guys, Pat here, and let's talk about how new vaccines are developed. So first and foremost, I want to ask, how are you? Are you safe? It's been a chaotic week again, considering the political issues in my country. So first and foremost, let us start with our word bank. So our first word for today is infectious disease. It is a disorder caused by organisms such as bacteria, viruses, fungi, or parasites. They are normally harmless or even helpful, but under certain conditions, some organisms may cause disease, and some infectious disease can be passed from person to person. The second word will be immune response. It is the reaction of the cells and fluids of the body to the presence of substance which is not recognized as a constituent of the body itself. Number 3 is immunization. It is the action of making a person or animal immune to infection, typically by inoculation. And last will be clinical trial. So these are experiments or observations done in clinical research. These trials evaluate the effectiveness and safety of medications or medical devices by monitoring their side effects on a larger groups of people. So let's get started with this article that I found in the internet. So vaccines are one of the most important tools in combating a infectious disease, but they come at a cost. Development is a lengthy process and it's also expensive. So vaccines are given to healthy people to prevent illness. So the rigor to which testing and safety are held is much higher than the treatments given to people who are already sick. This translates into years of clinical trials. Failure rate is high. To produce a safe and effective vaccine, researchers test multiple candidates over many years or sometimes decades. So to create a vaccine, scientists need to understand the structure of the bug or the virus, because in order to create a new vaccine, you need to know enough about the infection and to be able to mimic it. So all licensed vaccines currently available have been made using a traditional vaccine development model. So there are 5 stages to this process. The first stage will be discovery research. It takes 2 to 5 years and it involves lab-based research looking to find ways to induce an immune response at a molecular level. The second will be the preclinical stage. It takes 2 years and involves testing it to animals to assess the safety and sustainability of the potential vaccines for humans. Stage 3 will be the clinical development, involves testing potential vaccines into humans and has 3 phases. So the first phase says here the testing for safety. It takes 2 years and requires 10 to 50 people to take part in these trials. Phase 2 will be understanding the immune response. It takes 2 to 3 years and requires hundreds of people to take part in these trials. Phase 3 will be assessing if the vaccine candidate protects against the disease. It takes 5 to 10 years and requires thousands of people to take part of it. Next stage will be regulatory review and approval. This involves submitting data and information to regulators to gain approval for vaccines and can take for another 2 years. Next stage will be manufacturing and delivery. This requires specialist facilities that are highly regulated and expensive to develop. Following this model, a traditional vaccine could take more than 10 years to be developed and cost between $200 to $500 million. Developing a vaccine as quickly and safely as possible requires a new model with a fast start and many steps executed in parallel before knowing what works and what doesn't. to develop the COVID-19 vaccine quickly, researchers, developers, and funders must work together to streamline the vaccine development process. This means that doing the different stages of development and production at the same time to get the vaccine faster, and fund as many vaccine candidates as possible using a wide variety of approaches. We don't know where a COVID-19 vaccine will come from, so we'll need to try as much as different innovations and technologies to find one that works. It is also important to create a clinical trials sites across the world, not just in high-income countries. This will give us the best chance of finding a vaccine that is safe and effective for everyone. Next is to build a global manufacturing capacity. We will need billions of doses of those COVID-19 vaccines. And to meet this demand, says here that we have to invest in manufacturing sites now, before clinical trials are even completed, because we need to make sure that production can begin as soon as possible as the vaccine is approved. Next is to create new manufacturing sites instead of repurposing existing ones, and these are still needed to produce routine immunizations such as the MMR or polio vaccine. The world must keep up to the routine immunization whereas possible to avoid double burden of these outbreaks. Also, a large-scale manufacturing has never been done before some of the novel vaccine technologies that are being tried for the COVID-19. We have to build these production facilities without knowing if the vaccine candidate is viable. And we also make sure that the production sites are geographically distributed. If the vaccine is developed, it should be manufactured and distributed equitably to communities across the world and not only in richer nations. And to continue developing the most promising candidates, even if the current pandemic were to end, we should work towards a point at which successful vaccines can be stockpiled and ready for trials and emergency authorizations for future outbreaks, even if we manage to stop the current one without the vaccine. Developing a COVID-19 vaccine is a monumental task, and no single institution or organization can create a vaccine by themselves. To succeed, we'll need to rapidly build a new model of collaborative science and global manufacturing and distribution partnerships. This will not be possible without significant investment and public, private, and philanthropic collaboration on a never-before-seen level. A lot of people are protesting in my country about why is there no available vaccine yet. But the thing is, creating a vaccine takes time and money and a lot of patience, because to have a vaccine that is approved by the WHO and it should be in the clinical trial as mentioned earlier. It's been a really hectic start of the year, from bushfires, from wars, and now the COVID-19 pandemic. It's been a really crazy year, and I just hope a lot of you are safe. That matters the most right now. We're all in this together. We need to survive this chaotic time, even though the odds are not in our favor. That's just how I see it, because everyone is taking sides on how they approach this world global problem, and it's very upsetting to see a lot of people are lowering their moral standards, or let's just say not really helpful at this situation, like, you know, saying crazy stuff like injecting disinfectant, like, oh my god. Anyways, that's all for our episode for today, and I hope a lot of you would learn a lot in this episode. I will put the link in the description box below, and I hope to see you all soon. Bye bye.